it's Nurse Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate how to remove a Foley catheter on a female patient. So let's get started. Before you remove a Foley catheter, you want to make sure that you have a doctor's order. Then you want to confirm that you have everything, like the right patient, the right supplies, and that you've explained to the patient what you're going to be doing. And tell them that this is going to be a simple procedure compared to the insertion. After you've done all that, you want to gather your supplies. You're going to need a syringe. This is going to be used to remove the water from the balloon. And you can find how much water is in your balloon if you look on your Foley catheter. On one of the ports it'll say, like here it says it's a 14 French and it has been inflated with 10 mLs of water. You're also going to need several pairs of clean gloves, soap, water, washcloths, towels, and a waterproof pad because you're going to be providing peri-care before and after removal, a graduated cylinder to empty the catheter bag before removal, and several alcohol prep pads to help you remove the Statlock securement device. And then you'll want to perform hand hygiene and don clean gloves. So before you actually remove the Foley, you'll want to empty the Foley bag. And there may be urine in the Foley line, and if there is, what you want to do is you just want gravity to take that urine down into the bag so you can empty it and measure it. So if that's the case, you can unhook your clip if it's not clipped to the sheet, and then just gently take the tubing and lift it and let it drain into the bag until your line is clear. So once you've made sure the line is clear, you want to get all the urine in the bag so you can unhook this part, measure all the urine in a graduated cylinder, and then record that in the output section. Now some of it may be in this part of the bag, so if so, just tip it back and then you can empty it. Then once you've done that, doff your gloves, perform hand hygiene, and then don a new pair of gloves. So before we actually remove the Foley catheter, I'm going to provide peri-care, and I'm going to show you how to also provide Foley catheter care. So to do that, I went ahead and placed a waterproof pad under the patient that's going to catch any water, and then I've had the patient get in the dorsal recumbent position, lying on the back with the legs bent and spread so it exposes the genitals. Try to keep your patient covered up as much as possible, but giving you an area to work just to help them not feel as exposed. So what we're going to do first before we do care is we're going to remove this securement device. To remove this device, you're going to need several alcohol prep pads. First, what you want to do before you actually remove this adhesive is that you want to unclip this catheter from the clip in the device. So to do this, you're going to push the sides in like that and it just pops off. Very easy. Then we're just going to lift this up carefully and just lay it right here, and it shouldn't move, and it'll be safe and secure there. And then what we're going to do is we're going to take our alcohol prep, and it tells you here on the device, remove with alcohol. So you can start on either side you want. I'm going to start right here so you can see it, and I'm going to get this wet with the alcohol. And what this does is it neutralizes this adhesive that is on the patient's skin. So look, it's already starting to come up. So we're going to pull it up, and we're just going to keep cleaning the skin and cleaning the sticky part of the device, and it just easily comes up. We're going to do the same here and just pulling slightly here as we clean the patch and the skin, and it just peels right off. This is so much more comfortable for your patient than coming over here and just ripping it off. It could literally rip off that top layer of skin. So there, came off. Now you'll want to provide peri-care and cath care before actually removing the catheter. And if you need to refresh on how to do this, I have a detailed video on this topic if you click the card in the top right corner. Now let's doff our gloves, perform hand hygiene, and don a new pair of gloves. Now what we're going to do is we're going to withdraw the water that is in the balloon so we can remove the Foley catheter itself. We would never want to remove this catheter without withdrawing that water that's in the balloon. That would cause severe damage to the urethra. Here we have a 10 ml inflated balloon, so I'm going to get a 10 cc or ml syringe. On new syringes, you need to pop the seal on it, so just hold it, pull back on the plunger, seal's popped, and then just push it back in. Then what you're going to do, it's very, very simple. You're going to connect this part into the balloon part where you actually instilled whenever you inflated it. So we're just going to connect like so, and notice I'm not pulling back on the plunger, it's pulling the water out itself. This is what you want it to do. You do not want to pull back on this plunger. that can change the shape of the balloon, and then whenever we go to remove it, it could actually mess up the urethra. So we're going to let it remove itself until it gets to 10 cc's, and then once it has got to 10 cc's, we will disconnect. And this can take a few seconds. So it's now fully deflated. I'm disconnecting that. So once we've done that, we're ready to remove this catheter out. And what we're going to do is we're going to remove it out in one smooth, continuous motion. We're going to have the patient breathe in and out. That keeps the patient's mind on something else, plus that relaxes that urethra. So the patient breathes in and out. On exhale, you are going to pull. It should be extremely easy, just like that. No resistance should be met. If there was resistance that you felt, you want to stop, and you want to make sure that balloon is fully deflated and put back on the port your syringe and see if you have any water come out. So this was very easy, and what we want to do is we just want to inspect our catheter now. We are looking for any break of integrity. Is it all intact? The balloon look okay? Our balloon is right here. And we're looking for any weird growth or weird drainage that could be on it. If so, notify the doctor. The doctor may want you to send this to the lab, get it cultured. After you have inspected everything, you want to take this, just wrap it up in your waterproof pad and dispose of everything per the protocol. So after you've done that, you can get your patient up, go to the bathroom. If they're able, they can do peri-care again, or you can assist them with that. You want to doff your gloves and perform hand hygiene. So once everything's done, this is your time to provide education to the patient. So 1, you must tell the patient that they need to tell you when they're going to void next. Give them the call light. It really depends on your facility's protocol, so check it, but they should void within the next 6 hours. If not, you want to report that to the physician. And I like to have the patient go ahead, start getting up within an hour to 3 hours afterwards and just trying to void. And this void needs to be a complete stream. That tells us that's a complete void, not just a little dribble of urine. Now again, if they're unable to void within this time, notify the doctor. You're probably going to have to bladder scan them to see if there's any residual in the bladder and see if they're retaining. Now whenever they actually do void for that first time, you want to make sure it's not just in the toilet. You want to get one of those measuring hats to put in the toilet, and you're going to measure that first void and you're going to document it. So not only do you want to document the amount and the output, put it in your nursing note, and also talk about the color and if you noted any odor. Some things you want to tell the patient is that the bladder and the urethra is going to be irritated. So urinating may have a slight burning sensation, but it should decrease after a couple voids. In addition, the patient may have frequent urges to go to the bathroom, some incontinence, and issues starting a stream at first. But again, this should go away after a few times of voiding. And if it doesn't, they need to let the nurse know. Things that are not normal is that you need to tell the patient to report immediately if they develop a temperature, if they're completely unable to void, they have an odor to their urine, they have excessive bleeding, or an abnormal color. And you want to provide the patient with access to fresh water, because it's very important for them to drink at least 1 cup of water every 2 hours while they're awake to help flush out that bladder. And they want to avoid any bladder irritants like caffeine.